Hello and welcome. I am Kim Nitz, a Community Program Manager for the Parkinson's Foundation. We are passionate about helping every person with Parkinson's to live better, and so it is great to be reaching so many of you today with our virtual format. We have participants from around the Heartland as well as beyond. We welcome you all here today. Our program is in collaboration with presenters from the University of Iowa Healthcare Team and the Cedar Rapids Metro Parkinson's Association. We thank them for sharing their expertise with us today. You will find more information about each of our presenters in the confirmation email that you received. We want to remind everyone the Parkinson's Foundation is here to support the 1 million Americans living with Parkinson's disease, as well as the many who care for them and those who are working to end this disease. For those of you new to the foundation, we focus on 3 pillars: advancing Parkinson's research, improving care for those living with Parkinson's, and empowering the Parkinson's community with educational resources. These resources are extensive and include our website, parkinson.org, our free educational book series that you can download or order in hard copy. Here is an example of one of those. A library of recorded podcasts and webinars, and our hospital safety kit called the Aware and Care Kit. Many of you may be familiar with it. A great resource, if you have not connected with them yet, is our national helpline at 1-800-4PD-INFO, which is staffed by Parkinson's specialists ready to assist. Additionally, we have a set of newly diagnosed resources, which is a great starting point if you've recently begun your journey with Parkinson's. You can contact the helpline for more information. We support the most talented minds in Parkinson's research. We've recently launched an exciting initiative called PD Generation, which provides free genetic testing and counseling to those with a Parkinson's diagnosis. We now have a genetic test that can be conducted remotely, with participants completing an at-home test kit, then reviewing the results with a genetic counselor virtually. Visit our website to learn more or call the helpline. We are very proud of our 47 centers of excellence, those medical centers setting the highest standards of care for people with PD, including the University of Iowa, where today's speakers are joining us from. And before we get started with our first speaker, I do want to thank the silver sponsors of today's program, Boston Scientific and Kyowa Kirin, as well as our exhibitor sponsor, Accorda Therapeutics. Their support helps keep today's program and many others free and available to our Parkinson's community. You'll find educational materials about these companies by visiting our virtual exhibit hall at the link you see here on the screen, as well as in the chat. We are pleased today to have a great set of speakers with us. In your reminder email you received that there will be a link to their biographies so you can learn more about each speaker. We'll also be sharing that in a follow-up email along with a link to today's recording. So first, I am very pleased to welcome Pascale Doresca. She is an advanced registered nurse practitioner with the Movement Disorders Division at the University of Iowa Healthcare. She will share insights on why nutrition is so important to living your best life with Parkinson's. I'll turn it over to Pascale and let her start sharing slides now.
Thank you, Kim, for having me. Thank you for everyone who joined us today. My name is Pascale. I'm a nurse practitioner here at the University of Iowa Hospitals and Clinics. Today, I'm going to talk to you about nutrition in Parkinson's disease. Before we dive into nutrition, let's look briefly at some stats about Parkinson's disease. We have about 1 million people in the United States with Parkinson's disease and 10 million people with Parkinson's disease around the world. And then Parkinson's disease is the second most common neurodegenerative disease in the United States. And we have about 8,000 people in Iowa with the disease. The combined direct and indirect cost of Parkinson's disease for the United States alone per year is about $52 billion. And the average age of onset of the disease is about 60 years old, but we have people in their 30s and 40s diagnosed with Parkinson's disease. This means that after someone is diagnosed with Parkinson's disease, that person has a lot of years to live with the disease. And then, as a lot of you learned during the symposium about 6 weeks ago, Parkinson's disease is a complex disease that affects almost all the systems in the body. People have what we call motor symptoms like tremor, slow movement, and stiffness, but they also have many non-motor symptoms. Things like constipation or sleep problems or cognitive problems, low blood pressure, and bladder issues, etc. So why is nutrition important in Parkinson's disease? Because Parkinson's disease is a chronic neurodegenerative disorder. When you have it for life, and it's going to keep progressing. And the motor symptoms of Parkinson's disease, as well as the non-motor symptoms and the medication used in Parkinson's disease in the long term can progressively lead to severe disability. So nutrition status and nutritional needs keep changing during the course of the disease. So it's important to keep adjusting the nutritional intake so that we can learn the person with Parkinson manage any deficiency they may have, and they can live the best life possible with the disease and remain as functional as possible for as long as possible. Michael J. Fox, a famous person with Parkinson's disease, said that people with Parkinson's disease not only have 15 to 20 years of good quality life, but they also have a normal life expectancy. So some factors that contribute to the clinical condition of Parkinson's disease include the basic features of the disease, things like tremor, slow movement, stiffness, but also the progression of the disease, whether you are in early stage, in mid stage, or in late stage. The medication used in the disease, fiber intake, nutrients, fluids, micronutrients, and then pharmaconutrient interactions. So body weight is essential in Parkinson's disease because progressive weight loss or malnutrition is a major feature of the disease progression. And a number of factors affect body weight. People with Parkinson's disease, they have increased energy expenditure. They have tremor, dyskinesias, or extra movement, those wiggly movement that people get on levodopa therapy. They have stiffness. This is similar to like being in a constant workout mode. So that uses up a lot of your energy. And then people with Parkinson's disease have reduced energy intake related to their motor symptoms. It takes them longer to eat. They don't chew as well. And then they don't absorb their nutrient as well. They have cognitive impairment, some of them, where they forget to eat, or they may have decreased interest in eating. And they have decreased sense of smell, which can affect their taste. And some people do weight gain after they have deep brain stimulation surgery, which can improve dyskinesias and motor fluctuation. And some people also gain weight when they are on certain medication called dopamine agonists. One of the side effects of those medications is impulse control disorder, where people can develop compulsive eating. As we mentioned briefly at the beginning of the presentation, the GI system is a major system that is affected by Parkinson's disease. Everything from the mouth to the throat, the stomach, the large intestine, the small intestine, everything is affected. People with Parkinson's disease, they have pooling of saliva in their mouth. And they can have a jaw tremor or difficulty chewing. They can have aspiration because food can start going down the wrong pipe because they have difficulty swallowing. And then they have acid reflux, and then food just sit in the stomach for a long time, which can cause nausea, bloating, early satiety, and weight loss. And then they have constipation, which can cause things from abdominal discomfort to bowel impaction and complications. So the difficulty swallowing or dysphagia is a serious problem in Parkinson's disease because it can lead to energy imbalance, dehydration, risk of aspiration, and almost every patient in advanced stage have some form of dysphagia. And then delayed gastric emptying can cause malabsorption of levodopa, one of the medication that we use in Parkinson's disease, and one of the mainstay of pharmacotherapy in Parkinson's disease. And delayed gastric emptying can cause abdominal bloating, nausea, early satiety, and then constipation can have a lot of serious effect on the body. Let's talk now about levodopa and nutrition. What is levodopa? Levodopa has been around for 50 years. It's well tolerated, and almost everyone in Parkinson's disease at some point, they will be placed on levodopa. It's often combined with carbidopa so that it can make it through the GI tract. So the name carbidopa, levodopa, also called Cinemet, is a name that a lot of Parkinson patients are familiar with. So levodopa is an immediate dopamine precursor. So when it gets to the small intestine, it's absorbed through a large protein channel where other amino acids and dietary proteins are also absorbed. And then after it's absorbed to the plasma, it crosses to the blood-brain barrier via the same transport mechanism. And when it gets to the brain, it's metabolized into dopamine that replenish the missing dopamine that is one of the major underlying pathophysiology of Parkinson's disease. So in healthy people early in the disease, 90% of the levodopa is absorbed within the first hour of administration. But as the disease progresses, levodopa absorption gets complicated. And then when people take it with or right after a meal, it takes 2 to 3 times longer for it to get absorbed. Because as we saw earlier, it's absorbed at the site where other protein and amino acids are absorbed. So when we take it with meal, it competes with those protein to get for absorption, and then which can cause the dose to fail. It can cause the medication to be not as effective, to not get a lot of benefit from the medication, and for the medication to start wearing off early. So that's why it's recommended to take levodopa an hour before, an hour after a meal. And some people do get nausea when they start levodopa therapy. We usually ask those people to take their levodopa with a low protein or no protein snacks, such as a dry piece of toast, dry crackers, etc. So some factors that affect levodopa absorption include constipation, level of acid in the stomach, some medications, caffeine, exercise, and then something called H. pylori infection. So as the disease progresses, the therapeutic window of levodopa gets smaller. Early in the disease, you take the medication, it kicks in almost right away and work as it's supposed to work. But as the disease progresses, you take the medication, it takes a longer time for it to kick in. Then the therapeutic window is not as wide, so it doesn't last as long, and then people start developing dyskinesias. And then late in the disease, it takes a long time for it to kick in. People don't get as much benefit from it, and they have lots of dyskinesias and motor fluctuations. So at that, as the disease progresses, we kind of have to be creative to kind of make it work better. So some of the things that we do in this case would be, we would start manipulating the diet, kind of shift the protein. Some people need to eat most of their protein at night so that they can minimize the competition between levodopa and dietary protein, and their medication can work better. And then when people develop dyskinesias, we have to adjust the levodopa, give them smaller dose more frequently, or add control release formulations. We can start thinking about duopa, and then add other medication to make levodopa last longer, things like entacapone or rasagiline. But rasagiline, selegiline, they are in a class of medication called MAOB inhibitors. If you're on those medications, you have to be mindful of a substance called thiramine in the diet. Because thiramine, a high level of thiramine in the diet can lead to dangerously high blood pressure. And some food that contain thiramine include some aged wine, aged cheese, some beers, liver, etc. But if you're on just the dopamine agonist, pramipexole, ropinirole, corticotin, you don't have to worry about timing your meal and then thinking about dietary protein. They don't get absorbed the same way as levodopa get absorbed. And late in the disease, or at some point of the disease, people can start developing low blood pressure, something called orthostatic hypotension, which is a drop in their blood pressure when they go from a sitting to a standing position. Their blood pressure can drop as low as 30 points, and then they can start feeling dizzy, lightheaded, and some people can even pass out. So when that happens, hydration is one of the first things we look at. We ask the patients to drink at least 8 glasses of water every day, and to start eating salty snacks such as pretzels, and then to avoid hot or alcoholic beverages, to eat small meals throughout the day instead of 3 large meals, and to start wearing compression stockings. And if those measures fail, we have to think about medication to keep their blood pressure up. And then what about micronutrients or supplements? We don't have any good data regarding micronutrients or supplement in Parkinson's disease. We have no good randomized controlled trials that can back some of the micronutrients or supplements out there. So that's why when you have Parkinson's disease, you have to kind of keep having periodic nutritional assessment with your provider and your dietitian so that they can look at if you have any deficiency, we can address it. And then what we always recommend is to eat a well-balanced diet with lots of fruits and vegetables so that to minimize those nutritional deficiencies. In the past, we have had studies that looked at things like vitamin C, vitamin E, coenzymes Q10, and some health food, but those studies didn't yield any strong evidence that these substances have any disease-modifying properties. So in Parkinson's disease, nutrition is extremely important at the base of the pyramid for everyone, including with people with Parkinson's disease. We have water, lots of water, regular physical activity, fiber in the diet, and then periodic nutritional assistance to assess your specific needs. And then just a well-balanced diet with carbohydrate, protein, fats, lots of colors, fruits and vegetable. And then dietary protein, as you start developing motor fluctuation, we start thinking about dietary counseling to look at how we can redistribute the protein. And then we'll just keep working with dietitians and your provider to just assess your specific needs and balancing your diet. And at some point, if weight loss is very severe, we can start thinking about nutritional supplements. And in some case, late in the disease, if swallowing is a major concern, we start thinking about things like PEG tube to keep giving the person nutrients. So so work with your provider to find out what you need specifically, and then keep eating a well-balanced diet and lots of water and just regular physical activities. And thank you for listening. And now I'll let Becca talk more about diet and nutrition. Thank you.
Great. Thank you, Pascale. And that was an excellent setup to our next presenter. We'll welcome Becca Mallon, a registered dietitian nutritionist with the University of Iowa Healthcare. And I think she will inspire us with some more details around how you can use nutrition as a tool on your Parkinson's journey. So I'll turn it over to you, Becca.
Thank you so much, Kim, and thank you, Pascale, for such an informative start to this presentation. I think that there was a lot of information that will be very helpful to everyone watching. So I am going to get started on some more specific nutrition recommendations that you can implement in your disease process or the care of someone with Parkinson's. And I think you'll find that these build a lot on what Pascale just shared. So as a registered dietitian, I think one of the most important things you can do to eat a nutritious diet is build a balanced plate, just like Pascale said. So we want to put the focus on fruits and vegetables here. Bright colored fruits and dark green vegetables are going to have the most antioxidants, which have been shown to have great outcomes for brain health. I recommend making half your plate fruits and vegetables as a great way to start any meal that you have. The second thing I focus on is whole grains. So whole grains, as opposed to refined grains, are going to have more fiber. And like Pascale said, fiber is something that we really want to emphasize in the diet, having 30 to 35 grams per day. So things that have whole grains would be like whole wheat bread, whole wheat pasta, oatmeal, cream of wheat, brown rice, things like that. They're going to give you a great source of fiber. Now, dairy is something that can be incorporated in a healthy diet. It's going to be a good source of calcium and vitamin D, which help us maintain strong bones. If you do need to reduce the saturated fat intake in your diet, we can do skim or 1% dairy. That can be helpful. And there is research that does suggest that organic milk is an important thing to incorporate for reduced pesticides. Now, the last thing on your plate is going to be moderate portions of lean protein. And I want to emphasize that everyone's protein needs are going to be different based off of their current course of medication. So that's something that you can work with your own doctor or registered dietitian to determine how much protein is appropriate for you and when you should be eating that protein.
Hi,
so
Becca.
I think it's important.
Becca, real quick, this is Kim.
Yes.
So we can't see your slides currently. I don't know if you could.
My goodness. Well, thank you for letting me know. I have share screen selected.
Okay.
And oh, I did not hit share.
There we go. Thank you.
Okay. Well, perfect. Well, thank you so much for jumping in there. So this will make a lot more sense now that you can see what I'm sharing, but we've got this balanced plate icon right here that I think is a really helpful guide. And then of course, we've got our antioxidants from our fruits and vegetables, our whole grains, our dairy, and the moderate portions of protein that are going to be individualized for your own needs. And one thing I think is important is to learn which foods have protein. And when we take initiative to learn about that, we can find that there is protein in meat, poultry, and seafood, but there are also plant-based proteins that we can incorporate, like beans, soy, nuts, seeds, and things of that nature. Again, you'll want to consult your doctor or dietitian to find out how much protein you need. So one nutrient of concern in Parkinson's disease, like Pascale said, is salt or sodium. So for the general population, we recommend a low sodium diet. However, individuals with Parkinson's may need a higher sodium intake to prevent that orthostatic hypotension. So if your doctor has recommended a higher sodium diet to get more sodium in the day, here are some things I recommend. We can always consult our nutrition label to find out how much sodium is in a certain food. So we can compare two brands of a product and select the higher sodium option. It's important to drink enough fluids. And if you're having trouble getting sodium in, things like V8 juice or Gatorade have a little bit of sodium that can help you out. Canned foods can be a good way to get sodium as well. So canned vegetables, fish, meat, beans, all would contain sodium, and you don't need to rinse that off. And if you are a caregiver who has a low sodium need, but you're living with a person that has higher sodium needs, encourage them to salt their foods or help them add salt to their foods with a salt shaker so they can incorporate sodium into their own diet. Now, nutrients that are beneficial to limit, one of them is saturated fat. So a diet low in saturated fat and cholesterol can help reduce risk of cardiovascular issues. It can also help us maintain a healthy weight. Now, one way to do this is to use oil-based dressings and spreads instead of butter, for example. When we're choosing our dairy products, like I said earlier, we can choose the fat-free or low-fat. Our meats can be leaner, so like chicken breast or ground turkey, instead of higher fat meats. We also want to limit those processed meats like sausages, hot dogs, bacon, and ribs, since those can be higher fat meats. And we want to be mindful of our intake of high fat desserts. So ice cream, baked goods, cookies, cakes, things like that. They're things that we want to incorporate in smaller portions and less frequently. And then of course, our fried foods are going to be a source of saturated fat that we do want to be mindful of. Added sugar is another important nutrient to limit. A diet with too much added sugar can also contribute too many calories without enough nutrients. So when we limit added sugar, we want to do that through our foods and beverages. So instead of choosing sodas or other sweetened beverages, we can choose water, unsweetened tea, coffee, calorie-free beverages like that. Other beverage recommendations are listed below. For a naturally sweet snack, fruit is always a good choice. And like I said, when we do choose those desserts, we want it to be a once-in-a-while treat in a small portion. And of course, the nutrition facts label is always there to help you out. You can compare two different food products and choose one with lower added sugar. Now, hydration, of course, is very important with Parkinson's. Some medications can increase the risk of dehydration. And you'll see listed some symptoms that you may experience if your hydration is low. 8 glasses of water every day is a great place to start. I recommend always keeping a water bottle nearby that can help you remember to drink water throughout the day. Sipping throughout the day can be more beneficial than trying to drink large volumes of water at once. If you need a little flavor in your beverage, there's lots of ideas like herbal tea, flavored water, and if you need higher calories, we can choose higher calorie beverages like fruit juice and milk. You can also eat foods that are hydrating. So celery, cucumbers, grapefruit, melon, all sorts of fruits and vegetables have water in them. So it helps us meet our calorie needs while we stay hydrated. Now, like Pascale said, constipation is another common issue in Parkinson's disease, and our nutrition can play a role in that. So to avoid constipation, I think it's very important to have enough fiber in your diet, but to slowly increase the amount of fiber that you eat. So adding a little bit each day, maybe adding one new high fiber food a week. And as we increase our fiber, we also want to increase our water intake to go with it. Like I said earlier, we want to increase our fluid intake for the goal of at least 8 cups a day. So another idea is increasing physical activity throughout the day. When we're up and moving around, that helps our body digest and move stool through the digestive tract. So a couple meal ideas to increase the fiber in your diet are listed below. Things like chilies, soups, and stews can be a great way to get those beans. Oatmeal and berries are both high fiber foods we can have at breakfast. Again, we can choose those whole grains like whole wheat bread. And actually popcorn and whole wheat crackers, two tasty snacks, are also good high fiber foods that are beneficial for our digestion. And of course, any way we can get more veggies in is a win. Now, loss of smell is something that often comes up in Parkinson's disease, and it makes food less appealing. It makes us less interested in eating. So in order to improve our appetite when we do have that loss of smell, here's a couple tips that I like to recommend. So our foods can help stimulate our taste buds when our smell is not working so well. So lots of herbs, spices, lemon juice, anything we can do to really boost the flavor in our foods. Some foods like sour or tart foods can stimulate our taste buds and help us enjoy that eating experience more. One thing we don't want to do is add sugar to taste in our foods, like cereal or beverages, because it can really be hard to sense when we're having something that's just too sweet and giving us more added sugar than we need. When our sense of smell is not working so well, I find that incorporating different textures and colors on the plate is a great way to make our meals more appealing. So getting a lot of variety in there. So some things that are crunchy, some things that are soft. Maybe some green veggies, some brown rice, and a red sauce to pull it all together. And one food safety tip that I think is important is to pay attention to expiration dates. Since if our sense of smell has decreased, it's harder to tell when foods might be spoiled. Now, Pascale also mentioned the risk of unintended weight loss. All of the symptoms that we just discussed, loss of smell, constipation, nausea, and even fatigue, can make it more difficult to get our meals and snacks, and it can reduce our motivation to cook or eat. So, like Pascale mentioned, we want to eat small, frequent meals. I usually recommend having something every 2 to 4 hours. It's kind of common sense, but we want to stock the fridge and pantry with foods you really enjoy. So if you shop for someone who does have Parkinson's disease, ask them, what are your favorite foods? What do you love to eat? And make sure to have that on hand. If we're not eating as often or as high volume, we want to choose calorie-dense foods so we get the most bang for our buck. So foods like nuts, cheese, avocado, pasta, bagels, ice cream, and nutrition bars all pack more calories into a smaller volume of food. So it helps us get the most nutrition that we can with every meal and snack. We can add calories to our meals with sauces, especially like Alfredo or oil-based sauces. We can cook our foods in oil, so like sauteing or roasting. We could add nut butter to things like sandwiches, oatmeal, crackers, things like that. And we can also mix protein powders in. Smoothies or nutrition shakes can be very helpful for getting a lot of nutrition in a small volume, especially if difficulty chewing or swallowing is the cause of our reduced food intake. And of course, soft, easy to chew foods are important to reduce the fatigue that we could get from having a really tough, dense food to chew, like a chicken breast or celery. Instead, maybe we want to choose a softer ground meat, or we want to choose mashed potatoes. Now, bone thinning is another concept I want to talk about, and we can use calcium and vitamin D to improve our bone health and reduce the risk of osteoporosis and fractures that can be seen with bone thinning. So I recommend having dairy or fortified dairy alternatives 3 or more times per day. This helps us get the amount of calcium we need to keep our bones healthy and strong. If we don't choose to have dairy foods, there are non-dairy sources of calcium listed below. Calcium fortified orange juice is a big one. We can have canned salmon with bones. Soybeans and soy-based products like tofu do have calcium, and even leafy greens. Vitamin D is something that helps our body use calcium, and we get that from sun exposure outdoors. So talk to your doctor about your personal vitamin D level and see if adding vitamin D to your diet through a supplement or just by getting additional sunshine might be helpful for you. And again, the benefits of exercise are coming back. We want to aim for Weight-bearing exercise each day because that helps us maintain strong bones. So now that we've talked about the nutrients we want to get in our diet, I want to leave everyone with some tips that could be helpful for incorporating these things into your diet and really making it work for you. One common issue that I work with is planning nutritious meals for just 1 or 2 people. It can be challenging when a lot of recipes are written for 4 to 6 and we don't want to have, a whole lot of leftovers. I also get a lot of people telling me my food goes bad quickly. So I usually recommend buying single serving if possible, whether that's milk, yogurt, lunch meat, cheese. The more we can do single serving, the better, so things don't go bad. If we do buy larger packages of meat, we want to break that down into smaller packs and freeze it. We can choose things with a longer shelf life. So when it comes to protein, eggs and beans, they're going to last longer than fresh meat. Apples and oranges are going to last longer than fresh berries. And then when we do have a meal on hand, we want it to be single serving. So we can cook larger meals and freeze them in batches. We can also keep frozen fruits, vegetables, bread, things like that on hand and just use a little bit at a time. So when it comes to meal preparation, I think having a plan is very helpful for getting the nutrients we need. So when we can plan out our meals for the week, we can write our grocery list to ensure that we've got everything on hand and that we aren't putting anything to waste. Sometimes it can be helpful to have recipes that can be prepared in small batches. So scrambled eggs with veggies and toast, omelets, sandwiches, even cooking up 1 portion of pasta or an individual stir fry. These are all things that we can scale down to get a nutritious meal, but not make a huge portion of it. Like I said, if we do cook soup, stews, chilies, casseroles, things like that, we can cut them into smaller portions and freeze them so that it's easy to reheat whenever you need a meal. And I recommend the same thing with muffins, pancakes, waffles, things like that. Now, one thing that I do want to emphasize is that small changes really add up. Doing a complete overhaul of your diet might feel overwhelming, and that's okay. But making one small change at a time adds up to make a big difference. So nutrition doesn't have to be difficult and time-consuming. There's a lot of convenient foods that are quite nutritious. So just because it can be prepared in the microwave or it comes from a can doesn't mean it's not healthy. A lot of the great nutritious foods that fit on our balanced plate can be prepared in a very convenient way. So when we're introducing these foods, here's some tips for small swaps you can make. If you don't eat a lot of fruits and vegetables, that's okay. You can add a new one maybe every week, every 2 weeks, just to try and find out what you like. It's a simple swap to switch from using white breads, pasta, and rice to whole wheat to get a little bit of extra fiber. Other tips are listed below, and they kind of parallel what we've discussed so far. One thing that I do like to emphasize happens when we're dining out, when we're looking at restaurant meals. So when we're reading the menu, options that say baked, grilled, or light are probably going to be a better choice than something that says fried or creamy, things like that. So I want to leave you all with some resources that could be helpful for planning your own individual diet for you or a loved one. So My Plate is a resource that registered dietitians use and recommend to help our patients plan the diet that meets their needs. So I've got the link to that right here, and you guys should be able to access that when you look at this afterwards. This website also has plenty of recipes, and as you can see, you can select the type of dish you're looking for. You can search your favorite ingredients, and this will help you come up with some balanced meal ideas that are simple and cost-effective and easy to cook. Now, I get a lot of questions on what is the best diet for Parkinson's. Right now, the research shows that the Mediterranean diet is the most beneficial. It's the most research-backed, widely supported approach. While the Mediterranean diet is not vegan or vegetarian, it does focus heavily on plant-based foods. Eating more plants allows us to reduce our saturated fat intake and increase our intake of antioxidants, which are good for brain health, and that fiber that we said is so important. So overall, the research doesn't suggest that it's necessary to become vegan or vegetarian, but there is strong evidence for a whole food plant-based diet. So this is a link to the American Heart Association's article on the Mediterranean diet that has a lot of great tips. There's also a lot of good cookbooks out there that are written about the Mediterranean diet that can be helpful to browse through. Now, the MIND diet is another great intervention that has a lot of good research. So the Mediterranean diet is actually the foundation of this. It's the Mediterranean mixed with the DASH diet, which is a diet aimed to reduce hypertension. So the MIND diet is kind of a more specific version of the Mediterranean diet. It emphasizes the same foods like whole grains, beans, fruits, vegetables, nuts, and fish. It also incorporates small portions of meat, eggs, and dairy, which, like we mentioned, are those protein foods that we're going to individualize to you. So you can check out the bottom here to see the recommended servings per day for each of these foods. And research has shown that the MIND diet is really effective. In a 2014 study of over 900 patients aged 58 to 98, the MIND diet showed significant reduction in dementia risk, and even moderate adherence to this diet showed improvements. This tells me that starting somewhere with the MIND or Mediterranean diet is beneficial. So even if we don't get it 100% right, making these small changes can make a big difference. So there are plenty of cookbooks and resources that are available on the MIND diet as well that I'd recommend browsing through to get some inspiration and ideas. And that is all I have for you guys today. Thank you so much.
Thank you, Becca. I was thinking we'll be sending a link out with all of those slides. Those are going to be a great guide, I think, for our audience today to use with your nutritional planning. So thanks for that. In the theme of staying healthy, we now are going to take a quick wellness break with Kris Cameron. And Kris is joining us from the Cedar Rapids Metro Parkinson's Association, where they are a community grant recipient this year. And I'm going to turn it over to Kris to lead us in a little brief break here.
All right. Well, thank you, Kim. I appreciate it. And thank you for inviting me here today. This is actually kind of my studio I'm going to lead you in right now with the pandemic and also a storm that we had back in August. We're working out from here. So video classes are great. I really encourage you to do those. Check out the Health at Home classes from the Parkinson's Foundation as well. So, all right. So a couple of quick reminders before we get started. First of all, I want everyone to listen to your body, pay attention to how you are feeling today. Some days are better than others. We know that for Parkinson's and for all of us, but especially for Parkinson's. So make sure if you're feeling a little bit weaker, maybe a little off balance, a little lightheaded or dizzy, please stay seated when I do the standing exercise. And all of these exercises can be done both seated and standing. So secondly, I want to make sure you're in a sturdy, stable chair, kind of like this one that I'm in. If you have wheels on your chair, please don't move. I don't want you rolling across the floor in an office chair. So we're going to get started. It's great if you have a desk in front of you, a countertop, another sturdy chair in front of you, or especially someone to assist you if you need some assistance. So my motto, I want to say, is always, it's good to challenge yourself when you're exercising, but safety always, always comes first. So let's get going. So we're going to sit up nice and tall. I'm going to slide my chair back just a bit here. So sit up tall, feet flat on the floor. Now, if you need to sit at the back of your chair, that's fine, as long as your feet can sit flat on the floor. Otherwise, maybe put a little cushion or a pillow behind you, a rolled up towel. And then let's just, sitting up tall, take a big, deep breath in. reach the arms up. Exhale, bring the arms down. Good, do that again. Inhale, big reach up. Exhale, circle the arms down. All right, we're gonna take the arms up this time. We're gonna hold them up here so you can lace your fingers together, place one hand on top of the other. Try to reach up as high as you can, and then we're gonna lean over towards your right. So lean to one side, kind of stretching down that other side, and then over to the other side. And let's do that one more time, back to center. Slowly, slowly, just take it where you can. Back to center and over to the other side. Good. Now reach up one more time, deep breath in, and exhale, circle the arms down. All right, so let's do some little head turns. We're gonna go slow on these. It's important to keep your neck loosened up, but again, take it in your range of motion where you're able to move. So slowly turn the head to the right, looking over that right shoulder, back to center. Slowly turn to the left and bring the head back to center. We're going to do that one more time, nice and slow, looking over the right shoulder, back to center and to the left, back to center. All right, we're going to add something to that. We're going to take your right arm straight out in front of you. We're going to reach back as far as you can. Look back to that right hand if you can. And then exhale, bring the arm around to the front. Good, we'll do that on the other arm, reaching back. Nice deep breath in. Look back behind you. Exhale around to the front. Good, now let's take that. Reaching back, hold it there. And then exhale, bring the arm around. And then the left side again, reaching back, hold it there. And exhale, bring that arm around. All right, now we're gonna take both arms out. Let's just do a little push and pull. We're gonna pull back and push forward. So we're getting some nice big movement in through the back and the chest. And the goal with all these, what we're doing is just keep moving. So even if you're seated in your chair, you just wanna keep moving. All right, one more of these. And then we're going to drop the arms down and we're going to tap the toes. So just lift the toes up as high as you can. Now this you can do anytime. We want to keep those ankles flexible when you're walking, and you make sure you want to lift the toes up so you're not. Keep tapping those toes. All right, good. Now we're going to sit up tall. You can take the hands here or across your chest. Let's lift the knees up. Good, so just like you're marching in your chair, nice big knee lift as high as you can. All right, good. Hopefully everyone can still hear me here. All right, good. Now let's set both feet on the floor. We're gonna sit up tall again. And then this time, we're gonna take that right leg straight out and down, and left leg out and down. So nice straight leg, just stretching that leg out there. Good, we'll do one more. All right, now the one exercise I want you to do when you are done with this program today, I want you to do all the time is to sit to stand. You want to make sure you're sitting forward, really reaching nose over toes, hinging at your hips, reach, reach, reach. And then come back up. And then as you do that, if you can, stand all the way up, do a big stretch. And then slowly back and down to that chair. All right, so we're gonna finish up here, a big stretch with the chest. Open up nice and big. And then exhale, let's bring the arms around. Lace your fingers together, reach forward as far as you can. Open up one more time, big stretch. Let's open up through the chest, get that rounding in the shoulders out. And exhale, reach it forward. Good, take the arms out to the side.
and drop the arms down. And I want to say thank you to Rebecca. Let's take a couple of deep breaths in here as I do that. Hydration and exercise. So keep moving, drinking your water, and everyone have a great weekend. Thank you.
Thank you so much, Kris. And I want to remind everyone to use the Q&A function on the bottom of your screen for questions for any of our speakers today. We will have time here at the end. I'm now going to introduce our final speaker before that Q&A session. And we will welcome Brian Peterson, who is a speech language pathologist from the University of Iowa. And he is going to talk with us about that very important topic of swallowing safety. So Brian, I'll let you share your slides now.
Great, thank you. All right, I think, there we go. My title screen should be up here. So thank you everybody for joining me today. And yeah, like Kim mentioned, I will be talking a little bit about swallowing. And when we talk about swallowing and we talk about swallowing difficulties, we use the term dysphagia, which essentially means difficulty with swallowing changes that affect the safety and or efficiency of eating and drinking. And really there's many different causes for dysphagia. Some of the main ones that we see at the populations that we serve: stroke patients, traumatic brain injury, head and neck cancer, and the neuromuscular diseases like we're talking about today: Parkinson's disease, ALS, muscular dystrophy, inclusion body myositis, those types of things. And so really like I say, the general definition of dysphagia, difficulty swallowing, is very general, but the nuances for how to manage that and what that will look like is kind of unique to the different populations. And when we talk about kind of prevalence with dysphagia in Parkinson's disease, there are studies that have suggested that anywhere from 18.5% to 100% of patients with Parkinson's disease will have some kind of dysphagia. And now, obviously, that is a pretty wide percentage. And those percentages, that range of percentages, is kind of attributed to how the investigator was defining dysphagia within that study. Sometimes they've done some patient surveys or caregiver surveys, all the way up to doing kind of more formal swallow studies. And so there may be some abnormalities that a clinician would identify as abnormal, but maybe it's still functional for the patient. So that kind of is why, you know, that's so wide of a range. But what we do know is that difficulties with swallowing do become more prevalent as the disease progresses and it is in later stages. And one complication that can occur with any type of dysphagia is an aspiration pneumonia. We'll talk a little bit more about that later on, but aspiration pneumonia is the leading cause of death in patients with Parkinson's disease. And so from a speech pathology perspective, we obviously want to try to avoid aspiration and aspiration-related complications while also still maintaining as much quality of life and in a safe, efficient manner of eating and drinking. So some different things that you as the patient or you as the caregiver may notice that may suggest that maybe there's a dysphagia component going on is, as Pascale mentioned, some extended time to eat, which can be attributed to difficulty chewing foods or moving foods around within the mouth. A globus sensation, and so you are able to move stuff up or chew it up in your mouth, and then you push it back and try to swallow, but it just feels like not everything goes down. Drooling or loss of material out of the front of the mouth through some open lips if that lip seal is not quite as tight as it was before. Conversely to that, dry mouth. Obviously, if you're trying to put food into a dry mouth, move it around in a dry mouth, there's going to be more effort to move it back and down through the mouth and throat, which can lead to decreased intake overall. And one other thing that you may notice is difficulty swallowing medications. And so it can be just the larger pills or pills in general or what have you. So some things to keep an eye on with that. With the trained eye, the things that we're kind of looking for if we're referred, a patient is referred to us with some complaints or concerns of swallow function. We're looking for coughing, throat clearing, choking while eating and drinking. Are there any voice changes that are occurring while eating and drinking? And so what I mean by that is if we're assessing voice quality prior to taking a sip of liquid, let's say, and then the patient takes a sip, and then after that, it's really wet and gurgly, and it sounds like there's, you're kind of talking underwater. That can kind of put up an alert bell that there may be something going on. A weight loss trend, which obviously can be related to extended time to eat or decreased intake. But that can be a signal that there are some things going on. And fever or any respiratory changes that are noticed are things that we're really looking out for. And so it's really important to discuss any swallowing changes with your doctor, your primary care physician, or anybody really on your Parkinson's team as soon as they start to occur, so that a baseline assessment can be performed, and then some recommendations can be made from there. And so that's where, the evaluation and treatment with a speech language pathologist is really crucial to the longevity of safe and efficient swallowing. Because like Pascale mentioned, patients with Parkinson's, they have a lot of years to live. And so we want to make sure that we're keeping that swallow function as safe and as efficient as possible, while still maintaining that optimal quality of life. And so when we talk about assessment of swallow function, there are three main ways that we assess a patient's overall swallow function. The first is with what we call a clinical or bedside swallow study. And what's nice about this is that it really can be performed anywhere. No, you don't need any special equipment or anything like that. There are various liquids and food consistencies that are administered at our hospital here. We utilize our clinical bedside consists of ice chips, water, applesauce, diced pears, cracker, those types of things. So there's a variety of consistencies that we progress through. And really what this serves is kind of a risk assessment. What are we noticing? What are we seeing? What are we hearing that may suggest or may not suggest that there's a swallowing problem occurring, and or what is the risk of aspiration based on what we're seeing and hearing and feeling. And if there is something that kind of seems a little abnormal, or maybe we feel that the patient is at a higher risk for aspiration or difficulty swallowing, we would recommend an instrumental or formal swallow study. And so there's two different types of studies that we utilize. The first is this video fluoroscopic swallow study, or lovingly called the cookie swallow. And that is a swallow study that's done in radiology, or there may be some areas or facilities that have a portable radiology unit brought to them. But essentially what the way this is done is that various consistencies of barium are administered. You can kind of see on the screen here this dark circle here in the patient's mouth. That is the barium, and we're able to watch how that courses, how it's manipulated within the mouth, and then how it courses through the oral cavity through the throat into the esophagus here. And so really one of the benefits to this is that we really can see that swallow function throughout all of those phases of the swallow. The other type of formal swallowing assessment that we do is what's called a fiber optic endoscopic evaluation of swallowing, or a FEES. And the way that is performed, it's typically performed in the clinic setting because that's where we have the equipment. But again, there are some mobile FEES companies out there that can come to a patient's home or to a facility and administer this test. And it's done by placing a real small flexible scope through the patient's nose. We lovingly call it sort of like a limp piece of spaghetti. So it's very small. We put a little bit of numbing gel on the end, slides in through the nasal cavity, and kind of sits behind the uvula within the throat. And what's nice about this test is that we're able to utilize some of those real food consistencies like we did in the bedside assessment, but we're able to visualize directly into the throat. We're able to see those anatomical structures. We're able to see if there are some pooling of secretions or things that don't really show up on that X-ray swallow study, but can contribute to the integrity of swallow function overall. And so those are some of the positives of this test, but one of the drawbacks to it is that we're only able to really view what's happening inside the throat during the swallow. Because of where the scope is positioned, we can't really see what's going on inside the mouth. And so there are pros and cons to both of those instrumental studies, but really what we're looking for is, again, to kind of visualize the airway, visualize that danger zone where we could have some concern for aspiration. And I've mentioned a couple times the term aspiration, but haven't really defined it yet. And so what aspiration means is material getting below the level of the vocal cords in the throat. And so the vocal cords are positioned right behind where your Adam's apple is in your throat, and they kind of sit in a horizontal plane, and they kind of act as the last line of defense before you get to the windpipe and the lungs. And so in a larynx and in a throat that has intact sensation, if you swallow something down the wrong way and it gets down towards the vocal cords are slammed together, you'll have that cough, hack, sputter type of response. One of the things that we know about patients with Parkinson's disease is that sometimes some of that sensation within the throat at the level of the vocal folds is decreased, which puts them at a higher risk for what we call silent aspiration. So materials getting down the wrong way, but they're not having that spontaneous cough response to try to eject stuff out of that area. And so obviously, we want to try to reduce the risk of aspiration as much as possible, but still maintain the highest quality of life possible, but still without sacrificing that swallow safety or efficiency. Some of the strongest predictors for aspiration pneumonia are decreased mobility, patients that are more dependent on cares or have poor oral health. So just because a patient has some aspiration doesn't necessarily mean that we're destined to have aspiration pneumonia sooner than later, but in combination with these other things, that risk goes much higher. Some of the other contributors are poor oral health and decreased cough strength. As I mentioned, that if something gets down the wrong way, the defense mechanism that the body has built in is that cough to really blow stuff up and out of that danger zone. And so even if somebody has intact sensation here, but their respiratory function is such that they're not able to establish that strong drive, that can also play into respiratory complications. And so again, this is why it's important to advocate for early involvement and intervention with regards to dysphagia. As soon as you're starting to notice some changes, to get a speech pathologist involved, to get one of those, to get some sort of swallowing assessment done so that the overall swallow function can be evaluated, a risk of aspiration can be determined, and then maybe any compensatory strategies or therapeutic strategies that may be beneficial. But when we're talking about these predictors for aspiration pneumonia, as I mentioned, one of those big things is oral health, oral cares. This is one of the most significant factors in reducing the risk of aspiration pneumonia. You can imagine in a mouth that's not clean, there's a fair amount of bacteria that's in there. And if one is at a high risk for aspiration, especially silent aspiration, that bacteria getting down into the airway and the lungs can greatly increase that risk of an aspiration pneumonia. So that means brushing your teeth regularly. If you have dentures, keeping your dentures clean. While your dentures are out, brushing your gums, the roof of your mouth, brushing the tongue, all of those things to keep the mouth as clean as possible. And in situations of dry mouth too, making sure that, as has been mentioned a couple times, staying really well hydrated, utilizing saliva substitutes if necessary to help manage that dry mouth. And to really drive home that point again of vocal hygiene and overall hydration, targeting at least 64 ounces of water in a day, avoiding those things that are systemically dehydrating, caffeine, alcohol, things that are irritating to the tissue of the throat and the larynx, like tobacco smoke, vaping, that sort of thing. In situations of a dry mouth and throat, utilizing a humidifier, a personal face steamer like the lovely lady in the picture there is utilizing, can help that kind of surface hydration, that lubrication. Avoiding mouth breathing because it doesn't allow for that same filtering and moisture and warming as breathing through the nose does. And then managing reflux and sinus allergies or postnasal drainage. The GI concerns were a little, were touched on a little bit before, but just to re-emphasize those, if you are prescribed reflux medications, taking that as prescribed, avoiding those trigger foods and avoiding eating later on at night, staying upright after you eat for 30 to 60 minutes. And as Becca mentioned, from a nutritional perspective, from a reflux and kind of digestion perspective as well, eating smaller, more frequent meals can be beneficial. When we think about treatment strategies, there are some compensatory strategies, such as coordinating when you're eating and when you're when you're taking the medications. There, as we know, the further out that you get from taking your dose, as that dose starts to wear off, some of the symptoms present a little bit more overtly, and so that can be beneficial. There, as I mentioned, based on whatever the impairments are, some swallow strategies can be identified to help maintain that safe and efficient eating and drinking. As swallow function change, sometimes the safest and most efficient means of taking food and liquid is to alter the liquid or food consistencies. And so if you're having difficulty chewing things up, going more towards that softer diet, it can be beneficial. As Becca mentioned, from a nutritional perspective, smaller, more frequent meals, calorie and protein dense meals. And then sometimes too, if the tremor is, especially in the hands, is significant, utilizing some modified utensils or cups, working with an occupational therapist can be beneficial to really optimize those things. When we talk about, direct treatment strategies for dysphagia or swallowing, there are a couple different treatment approaches. The McNeil Dysphagia Therapy Program is one where it's really emphasized on strengthening the muscles of swallowing by swallowing. And so, you're with this therapy program, you're swallowing hundreds of times in a session to really work that musculature. There are some other traditional swallowing exercises that can help with efficiency, strength, and airway protection. The IOPI is the Iowa oral pressure instrument, which looks at lingual strength. And then expiratory muscle strength training can be beneficial for maximizing that cough response and that cough strength. And so really the take-home messages from my chat today: dysphagia can develop at any stage of Parkinson's disease, but again, tends to be more present in the later stages. And so it's important to monitor for any changes in eating behaviors and or any overt signs or symptoms of aspiration, like I say, coughing, choking, changes in voice, throat clearing consistently with eating and drinking. Requesting a referral to a speech language pathologist, and really kind of staying on top of that so that you can get some of those strategies on board as soon as possible to maintain that necessary by mouth intake and the quality of life. Completing oral cares daily and swallowing hard and very intentionally to really maximize the muscular squeeze of the throat. Participating in appropriate vocal hygiene and hydration, and then staying active and exercising. Those are all good things that will just help keep that swallow function as optimized as possible. So I thank you for tuning in today.
Thank you very much, Brian. That was great information.
Stop share.
So we're actually going to bring all of our speakers back on screen now for a question and answer session. We appreciate the questions that we've received. And I'm going to go ahead and start it off with one for Pascale. Is calcium like protein to be avoided because of interference with the dopa meds? This person has osteoporosis.
Hi, Kim. It does look like Pascale may have gotten disconnected, so you can move on to the next question for now.
Okay, I will do that. This one is for Becca. And this person sounds like a caregiver. And they're saying, how do I encourage a healthy diet lifestyle for my person with Parkinson's if they are not very interested in that?
To start your video.
Oh, and it sounds like Pascale has come back.
Yes.
Great.
Where is it on? Yes. Can you hear me?
We can hear you great.
Sorry, my internet cannot.
Well,
Yes.
those
Is
things
there a
happen.
question for me?
Yeah, you know what? Let me go ahead and have Becca answer this one. Excuse me, and then I'll come right back to you.
Okay.
Yeah. So Becca's question was about if a caregiver helping their person with Parkinson's, how to encourage that healthy lifestyle.
Absolutely. I think there's two big things that I would say. The first thing I would say is to share those healthy meals together. So prepare those balanced meals with a mix of vegetables, protein, and grains, and share them with the person you're caring with. So say, I like to eat this way, and I think that you would like it too. And then I think also asking what kind of meals they like to have, or taking similarities from their favorite meals and incorporating it into a healthy, balanced plate. So it's all about small changes and working together.
Excellent. So then back to Pascale. Is calcium like protein to be avoided because of interfering with the dopa medications? And this person has osteoporosis.
No, calcium shouldn't be avoided. The only thing that interacts with levodopa in the diet is protein. And then calcium, especially if you have osteoporosis, you need the calcium and vitamin D. So you shouldn't avoid calcium.
Okay, thank you. One for Brian. You mentioned with swallowing, if I need to take a large pill and I really struggle with that, what are strategies I should be using?
So yes, there are a couple different things that can be beneficial. If it can be broken up, that can help. If you're able to put it into like a spoonful of yogurt or pudding or something like that, something that can kind of envelop the pill a little bit easier and help it slide down rather than it just sticking inside the mouth or throat. If it's an issue with having a dry mouth and throat, sometimes lubricating before you're going to swallow the pill, so taking a sip or two of water, making sure that the tissue is nice and moist before you put in the medication and then swallow. Those are just some things that just kind of pop into my mind without knowing exactly how the pill is getting stuck or what the difficulty is.
Okay, great, thank you. One for Pascale. Do I need to let my
Kim?
Yes.
Can I say something about the last question?
Sure.
About the big pill that the person is struggling with? One thing that can be done is to talk to the pharmacist and ask if the pill can be quashed, because some pills can be quashed, some cannot. So talk to your pharmacist and ask specifically about that pill, whether it can be quashed.
Great tip. Pascale, again for you, do I need to let my doctor know if I'm taking supplements, like you described, the micronutrients supplements?
Yes, it's important when you go to any provider to ask to tell them to have a list of your medications, including the supplements you're taking, because the supplements can also interact with both your your listed medications and especially the carbidopa, levodopa. So it's to have a complete, like an updated med list, also include your supplements.
Great. A question for Becca. What are the best oils to be using for a healthy diet?
That's a great question. So all oils are going to be unsaturated fats, which are the heart healthy type of fats. So my biggest tip is to get a variety. Olive oil can be great, canola oil, avocado oil. They're all different when it comes to cooking, but nutritionally they're pretty similar. So get a variety.
Great. Okay, and for Brian, this person says, it's been a couple of years since I did speech therapy. Can I do it again now?
Absolutely, especially if things have changed. I would certainly encourage you to reach back out to either your provider to get a referral, or to the speech pathologist that you worked with, to kind of get a reassessment and kind of tune things up as needed.
Okay. And back to Pascale, you mentioned foods I should avoid due to specific PD meds. Could you restate those foods? And Pascale, I think that we'll be sending out a copy of your slide that shows those. Is there anything you want to say to that?
So the big one to avoid, not avoid, but just be mindful of, is when you eat in relation to your levodopa. You should try to eat half an hour or an hour before a meal, or an hour after the meal, so that the levodopa and the dietary protein don't have a chance to compete, which can impede the absorption of the levodopa. And then the other thing, if you're taking an MAOB inhibitors such as rasagiline or selegiline, you need to be mindful of thiramine. And this thiramine.
Uh-oh. So I think we've lost Pascale. If she comes back, we'll have her finish that. But please know we will be sending out a copy of her slides that do show that table and the medications. I've got a question for Kris. This person lives alone, but wants to be doing exercise
Things
virtually.
like aging and some other food.
Pascale?
Yes, can you hear me?
You cut out for a bit, so I let everyone know we would be sending that information back out.
Yes, they have.
Oh, darn it. Well, so I'm going to go back to Kris. So Kris, somebody lives alone, wants to do at-home exercise. What precautions do they need to take for safety?
Yes, that is a great question. First of all, I would always, again, be aware of your surroundings. So make sure that you exercise in a safe area, nothing around that, if you should lose your balance, that you're going to fall against. But then you can have a sturdy table, desk, countertop, anything like that, where you can place your hands on that and, just for a little balance support. A good sturdy chair, again, is important, holding on to a chair. But the thing is that a lot of these exercises can be done seated. So even if you are concerned, and again, everyone with Parkinson's, your day is different every day. And if you have one of those days where you're like, I'm not quite feeling as balanced, or, get up and go that I usually have, stay seated. The main thing is that you're moving, and certain things that you should be moving, your upper body, your legs, doing those toe taps and keeping those ankles flexible. Those can all be done from a chair. So just kind of, again, judge your surroundings and make sure that you do have something safe, you know, like that sturdy countertop or a sturdy chair, but sit down anytime you need to.
Thank you. For Brian, this person says, my swallowing problem is primarily an issue with mashed foods or soft consistency foods. So any recommendations on that?
I guess I don't know what the exact difficulty would be. Typically those tend to be a little bit easier to manipulate if it's a matter of there's not enough, if it's still too thick moving back, sometimes making sure that things are really, you know, almost more like a runny puree we talk about, you know, that there's a lot of moisture content to it, that it doesn't take as much oomph to get it moved down, that it slides a little bit easier. I guess it's kind of, it's a little bit difficult to know exactly what's what to recommend without knowing what the difficulty with the mashed foods is.
And it sounds as if probably you'd want them to consult with their own speech language pathologist.
Absolutely. Yeah, that would be one of those things. Yeah, to just to advocate for, so that you can really get, you know, that assessment, and really it's a lot easier to make recommendations when you can kind of see and look and listen to what's going on.
And, you know, on that topic, so if one's doctor is not recommending speech therapy, what should the person with Parkinson's or their care partner do?
Well, I think that, you know, there's something to be said for, you know, speech therapy is in weekly visits and exercises and that sort of thing. But we know that one of the biggest causes of death is aspiration pneumonia, that sometimes a patient will have be at a higher risk for aspiration and not really know it. And there can be, you know, changes to swallowing can occur subtly over time to the point that it's not as noticeable to the caregiver or to the patient. And so, you know, I think that if you are noticing something as a patient or a caregiver, you know, to really be, you know, to really advocate for getting at least that baseline evaluation, getting that baseline assessment done, so that you have a reading of where things are at right now. Any recommendations can be provided, and then if and when things change over the course of time after that, you then have something to base it off of.
Thank you for that. A question for Becca. This person lives in a senior community that provides their meals. So any suggestions on how to make sure those are as nutritional as possible?
Absolutely. That's a great question. So most assisted living facilities do have a registered dietitian on board who helps them plan their meals, as well as provides nutritional guidance one-on-one if a resident may need it. However, there are things you can do within those meals to optimize them for your health. So portion sizes are huge, making sure that fruits and vegetables and plant-based foods take up at least half of your plate. It's also important to consider some vegetarian entrees sometimes, you know, if those are available. We can also be mindful of our added sugars and saturated fats and refined grains. So if dessert is offered with every meal, think about only choosing your favorite desserts maybe once per day and having them in small, mindful portions. So I think all of these things can allow you to take control of your nutrition, even when you're not the one doing the cooking.
Excellent. And then this will be our last question for Pascale. Pascale, hi. So we have got a person asking, on your last slide, you talked about having, you know, the monitoring by a registered dietitian or a nutritionist. Is that something that can be requested from one's physician or provider?
Yes, we can put a referral to dietary or nutrition consult if that's something, like some people, it depends, everybody is different. Some people have a good understanding of diet and many things. But some people from the beginning, they struggle with the diagnosis and what to do, and they have so many questions. Then we would refer them to a dietitian so that they can get their questions answered, and they can discuss things like Becca talked about from the beginning. They can have that understanding.
Okay, great. Well, lots of good strategies shared. I want to thank all of our expert speakers today. I think this was wonderful information for us to take forward with us. And I love the idea that we can use these slides, when we send them out afterwards for some follow-up information. There may have been questions that did not get answered today. I always encourage you to call our helpline or talk to your healthcare provider.